Now, moving on from general principles and how to take history examination and what is the radiographic assessment of spinal cord injury, we are moving on to the two very important lesions of the spinal cord. One is Brown-Sequard syndrome or Brown-Sequard lesion, and the second is spinal stenosis. In this section, we'll be going through the prognosis and treatment of Brown-Sequard lesion. What are the different types of spinal stenosis? How to diagnose spinal stenosis? What are the different treatment options in case of spinal stenosis? So what is Brown-Sequard lesion? Classically, it's called as hemisection of a spinal cord. If a patient had a history of some kind of a stab from behind in which half of the spinal cord may have been transected, the classical presentation usually of patient presents with history of Brown-Sequard. As I just told you, there are three main tracks which are of utmost importance. One is the corticospinal tract, which is the anterior track or the motor tract, which is coming. If you see this diagram, this is the ipsilateral corticospinal tract, which is coming all the way from the pyramidal tract right on the same side. Then this here is actually contralateral. This is called as ipsilateral. This is contralateral spinothalamic tract, and this is ipsilateral dorsal column tract, which is coming all the way. This is sensory, which is entering in here and going all the way towards the sensory cortex. But the problem is that if this side, let's suppose this whole side is damaged. Now, although on this side, the damage would be towards the corticospinal tract and dorsal column tract of the same side, but as you can appreciate, the spinothalamic tract actually, which contains temperature and pain sensations, are actually going towards coming from the other side of the body. Therefore, the pain and temperature of the contralateral limb would be affected. So the lesions usually present with this kind of a classical history is that there is ipsilateral upper motor neuron weakness, and leading to why? Because of ipsilateral corticospinal tract lesion. Then this could be in touch, light touch, vibratory sense, dysfunction. All these senses should be lost on the same side except pain and temperature, as the pain and temperature is contained in the spinothalamic tract, and that is actually coming from the contralateral side. So therefore, usually if this lesion is, the pain and temperature of the opposite side is lost below the level of the lesion, and then it is actually maybe caused by it could be a tumor or trauma. As I told you, if somebody stabbed someone from the back, this could lead to hemisection of the cord of this tumor, which is compressing only this half of the spinal cord. Therefore, it can lead to Brown-Sequard syndrome. Other causes could be ischemia or herniation. This could be that the disc on this side may be compressing only this side of the spinal cord, which eventually leading to Brown-Sequard syndrome. And rarely, but yes, once the tuberculosis starts anteriorly, once it starts in, then it can progress from the anterior to posteriorly, and eventually involving a whole of the half of the spinal cord, eventually leading to Brown-Sequard syndrome. So what happens is, it's the ipsilateral corticospinal tract which is lost, leading to upper motor neuron or motor paralysis. Ipsilateral dorsal column is lost, therefore the skin, vibration sense, and light touch of the same side is gone, and contralateral spinothalamic tract which is lost. That is the loss of pain and temperature of the opposite side. So this, as I told you, what are the signs symptoms which can present with is, could be one of the cause could be trauma to neck or back. Classical is usually a stab. Then could be loss of temperature and pain of the opposite side. Always remember, as the spinal thalamic tract actually traverses towards the opposite side, therefore it is always the loss of pain temperature of the opposite side. There will be loss of bladder control. If suppose this has happened in the lumbar region, there may be associated abnormality as well. Usually weakness and atrophy of the muscle and leading to upper motor neuron lesion. Paralysis, which is spastic paralysis, and maybe if in lumbar could be loss associated with bladder control as well. Coming to the prognosis and treatment, it depends upon the cause. If it's a tumor, depending whether you can take out the tumor or not, and what else needs to be done as well. Usually 99% are ambulatory to the final follow-up. Best prognosis for the function of the motor activity is usually that motor activity is lost, but sometimes some degree of sensory losses always remains, but usually motor activity usually completely recovers. Treatment option includes is steroid use and symptomatic and supportive treatment. And if it is, for example, if it's an ongoing offending cause, if it's, for example, due to tuberculosis or some kind of tumor, then we need to treat the underlying cause as well. Coming to another disease now, spinal stenosis. It is actually caused by complete cord hemitransaction. Now, this the difference is the one is that transaction from in anterior to posterior plane, which results in Brown-Sequard syndrome. But if in either anteriorly or posteriorly half of the cord is lost, this may result in a spinal stenosis. It's usually in a penetrating trauma. The typical clinical syndrome is called as associated with spinal claudication or neurogenic claudication. Usually patients who are have some kind of degree of spinal stenosis, when they usually move uphill, as this results moving uphill, actually the lumbar curve, has to be increased lordosis. This actually compresses the spinal cord, leading to production of symptoms called as spinal claudication, that there's numbness, paresthesia, and weakness of the lower limbs when they're moving uphill. But normally when these people move with slightly bent forward, this flexion maneuver at the lumbar spine actually causes increased diameter of the spine, leading to resolution of these symptoms. Symptoms include, could be pressure on the cord or the nerve roots resulting in radiculopathy, or there may be associated myelopathy. Once the disease progresses, eventually leading to tiredness and weakness. There may be associated paresthesias or numbness depending upon which root is involved, and there may be associated bony decompression nerve structures, because in old age osteoporosis, with advanced osteoporosis, usually this results in these osteoporotic compression fractures, in which actually this impinges on the vertebra, impinges on the nerve, leading to decreased spinal cord volume and compression. This may be, if it's in the lumbar region, this may be associated with cardiac syndrome, leading to bowel and bladder dysfunction. There could be problems with the walking and balance. Why? Because the myelopathy, they are unable to maintain the muscular tone and posture, so that they are unable to walk properly at times. So what are the different types of spinal stenosis? One is cervical stenosis, which includes narrowing in the neck. For example, if anything is compressing from outside, or due to edema or due to any injury of the spinal cord, this may be resulting in the spinal stenosis of cervical area. The second is the lumbar stenosis, that is narrowing in the lower back. Usually the more common form is the lower one, which could be either due to advanced age, due to degenerative changes. Other causes include the spondylosis, in which there is actually due to defects of the pars ventricularis, there may be associated with increased slippage of vertebra over the sacrum, and once the slippage occurs, they may affect the lumbar region, leading to canal stenosis. So how the diagnosis is made? Diagnosis is based on the history, examination, depending upon what elements of radiculopathy and myelopathy are present or not, and then X-rays of spine. So cervical till lumbar we have to get in as well. Then legs and knees may also be involved, because in lumbar region there may be other associated comorbidities as well, which may present with a similar kind of symptoms. CT scan would reveal whether there is associated bony injury or not as well, and MRI would show exactly how much cord is compressed. And lastly, we can go for EMGs, especially if associated with end stage muscle weakness. Other blood tests may not be required for the diagnosis, but yes, once we are planning for surgery, we need to be sure whether the patient is fit enough for surgery or not. Coming to the treatment of spinal stenosis, this actually, if it's not very symptomatic, or it's mild symptomatic, it can also be relieved with some degree of exercise and physiotherapy. It's simply, the initial treatment could be NSAIDs associated with acetaminophen, or even corticosteroid injection, but they're usually in the very early phase of the treatment. Other includes, depending upon which the cause of the, if it's the disc which is actually causing some degree of spinal cord narrowing, or it is due to it's just compressing the spinal cord, then the options could be decompressive laminectomy, in which the lamin of the actually are removed, so that there is enough space for the spinal cord and to further resolution of the symptoms. But if it is in cervical, this could be leading to cervical laminoplasty. But usually these requires not only removal of lamina plus stabilization as well. There will be associated anterior posterior stabilization depending upon how much degree of kyphosis is involved in case of spinal stenosis. In this section, we've gone to very important diseases. One is the Brown-Sequard syndrome and another is the spinal cord stenosis. Brown-Sequard is also called as hemisection of the cord, in which half side of the cord is damaged, leading to ipsilateral corticospinal tract damage, ipsilateral posterior column tract damage, and contralateral spinothalamic cord damage. This results in weakness, paralysis of the same side, with along the loss of fine touch, vibratory sense, and skin changes of the same side, and loss of pain and temperature of the other side. Treatment is usually supportive and symptomatic, and usually 99% of the people eventually recover completely. Although there is associated some degree of sensory dysfunction may be associated with Brown-Sequard in the long run. That's all from now. Keep watching sqadia.com.